Welcome to the Morningstar Podcast, a space for real conversations and shared experiences. Together, we'll explore the ideas and stories that inspire, guide, and connect us all. Let's get started. The Morningstar Podcast discusses topics related to recovery, addiction, and mental health, which may be sensitive for some listeners. We are not medical professionals, and this podcast is not a substitute for professional advice or treatment. Listener discretion is advised.
All right, welcome back, everybody, to the Morningstar Podcast. It is a nice, balmy Wednesday afternoon here, and I'm sitting with my friend and a man I've admired for many years now, Jason Grueneich. Let me tell you a little bit about Jason here. I met Jason. I could be wrong. I met Jason 9 years ago, 9 years ago, and I saw the benefit that he provided to the community. I saw the engagement that he gave to the individuals in his life. I saw the energy as well that he had. And if you're a guy who is not an energy guy, because I'm not an energy guy, I am not a stand on your chair. I walk into a room and I'm best friends with everybody in 30 minutes kind of guy. I struggle. I want to sit in the back. I want to be alone. I want to check boxes as to it's okay. You know, of course, I'll shake hands and I'll try to be polite and respectful and professional and everything I need to do in these social settings. And Jason is the kind of the exact opposite in my eyes. I mean, he's the guy that's he's gonna make you come out of your comfort zone, and he's gonna make you smile, and he's gonna make you feel that at that point in time and for those moments that you are the most important individual to him. And it's a very rare talent, and it's not even a talent. It's just an authentic quality of an individual, you know? And so it's always a pleasure to, Jason and I don't get to spend a whole lot of time together, truthfully. Haven't seen each other and it seems like a while, but I just know the excitement and the joy and the camaraderie he brings to the individuals in his life. And so kind of bringing him on here was kind of a no-brainer to me. So I'm really thankful that you took time out of your day to spend an hour with us and see what we can get into. So do you want to just start by telling everyone about who you are, a little bit about yourself, anything that you feel comfortable discussing right now? So,
definitely. Thanks, Craig, for that introduction. Wow. Yeah. You got me humbled over here. I'm usually all energy, and now I'm just kind of speechless.
Yeah, now I'm really quiet and humble now.
No, but thank you. I appreciate that. You know, like you said, name is Jason Grueneich. I am originally from this area, Bismarck, North Dakota. Grew up here, ran the streets here, got into trouble here. You know, part of my story is my story of recovery. You know, and it was interesting. I left here, I think, in 98 and took off for the Twin Cities and was there until about 2016 when I came back to Bismarck, North Dakota. So came back here to find some recovery. I never thought I'd end up back here. I swore this was the last place I was going to be. So for me coming back, it was not by choice. You know, it was kind of kicking and screaming that I came back, and I'm really grateful for it. Never thought that I would find a reawakening of myself within this city that I grew up in, my hometown, and then be able to discover myself and start giving back to the community. That's the craziest thing for me. To be an active part of the community it just blows my mind. You know, as we kind of get into the story a little further, I just never imagined it, and yet here I am, getting ready to sit down for a podcast with you, you know, do all of this and then be a big part of the community. So,
I think it's always exciting to hear the different perspectives from individuals of where they were, where they came from. Right. And then talking about the present moment of, I used to be this, and this. Yeah. I never expected these years later, I would be starting this. I would be involved in this.
Yep.
And I'd be sitting here face to face with you talking about these things and reaching out to community members, reaching out to individuals who just might need to hear this, who might be at their last straw, this might be the last thing that they hear. Right. before making a decision on whether to go or to continue, whether to stay or to leave, whether to drink or to go to a meeting, whether to any of that stuff, right? Maybe I needed to hear that because now I need to call my mom and I need to express my gratitude to her, you know?
Yeah.
And it's always really cool. It's really cool to hear that stuff. When you say that you came back to Bismarck and now you're involved in the things you're involved in now, do you feel that there is a calling? Do you feel a responsibility? Because I know a number of what you've done in the past. I know your involvement with the recovery community. I know your involvement with individuals and the engagement that you provide to them. But do you feel a calling or responsibility to continue to do that and also to kind of elevate, to find new ways in which to do it?
100%.
Yeah.
It blows my mind
Yeah.
to even talk about it and to be thinking like this in my life. It's almost, there was this point over the last few years that something changed in my life and I began to be called to servant leadership.
Yeah.
And to work with my entire community about helping and pulling those back up. You know, I was lost in the darkness once before with my substance use and alcoholism. And I remember distinctly the people throughout my life who kept reaching the hand out to kind of pull me out of that darkness, to shine a path for me to go down. And I would always deny it and I'd fall back into my addictions and alcoholism. And once I finally came out of it, realizing that it's not just for me to help those in recovery, but to be able to give back to the community that I'm a part of, to be an active member of a community. And it blows my mind.
Yeah. You say, and it was kind of, I was sitting here thinking of following up with that. And you sort of summed it up in that being an active member of the community. So I know of the things that you're involved in today. And would you say that your work is activist work? Would you call yourself an activist? Is that aggressive? Is that, you know, does that make sense?
It's not aggressive.
Yeah.
It makes sense. I don't think I've ever thought of myself
Sure.
in that regard.
Yeah.
But I guess.
Yeah.
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 You know, it goes back to that, you know, those who don't have a voice
100%.
and those who don't realize they have a voice to be shared.
Yep.
And how can I help facilitate that? I don't want to be the one to speak for people. I want to be the one to help everyone speak up, I guess. So I guess, yeah, I'm an activist.
Absolutely.
That's crazy.
Yeah. I was talking to a guy yesterday and he was talking about his family and that, and he mentioned his wife is an activist and I don't know what she does or doesn't do. And this is not anything, literally has nothing to do with her, but I remember hearing that word and it's like, how do you define what that is in somebody's life? Because it's kind of the evolution. Are we activists in our day to day, you know, as individuals with MHA recovery, as individuals in a community where we try to navigate altruistic expressions and give of our time, you know, is that a call for activism, you know, like how do you bookend where that is and where it isn't, you know? And it's good.
You know, honestly, for me, I found my voice and who I was through my recovery.
For sure.
And in that journey, I realized that was such a small part of my life. I didn't realize because my addictions had been such a huge part of my life. But as I gained recovery, yes, it's a big part of who I am, but it gave me access to a world and a life I never understood was out there.
Absolutely.
And when that door opened, I couldn't just hide in the recovery community anymore. I had to be a part of the larger community of humanity. You know?
I agree. And I appreciate the way you said hide in there. And it's no indictment on individuals who dedicate their life to that. I also believe that at some point giving back, I don't want to echo chamber. I don't want to limit myself to who is deserving of help and who isn't, and for why and for what creed and what nationality. You know, we have these expressions of nobody is left behind, that everybody is given an opportunity. And if you feel that at that point in time, the opportunity is for help is always there for individuals who are seeking recovery. But then what about the individuals who have sought it and they're still identifying things that they need help with?
Yeah.
Where do we go and how do we handle those situations of, you know, sorry, that's not my That's not my field. That's
Yeah.
not my specialty. I don't know what to tell you. I don't know how to help you. Let's figure it out.
Mm-hmm.
You know? So I completely agree. Do you want to talk a little bit about, so I know, and I want you to talk about it. But I know you started a nonprofit.
Yeah.
I know very little about it other than the basis of it. Do you want to give it to us?
Yeah, let's
Cool.
do it.
Yeah.
I'm actually honored to be able to sit here with you today
Cool.
on Morningstar. This is going to be the first time I actually kind of talk in depth
Heck yeah.
about my personal story
Yeah.
and share it with the community a little more and talk about
Absolutely.
how everything intertwines, it's amazing how it all is interconnected. So we touched a little bit on my recovery and, during my substance use and struggles with addiction and alcoholism, I actually contracted HIV in Minneapolis, and that was in 2006. Until recently, I haven't publicly talked about this at all. I did just up at the Capitol during the legislative session for the first time. And a lot of it has to do with stigma, and how it interacts in the communities and the fear that comes up from it. And I think that goes hand in hand with recovery, with substance use. People are scared to talk about that they have an addiction or alcoholism, and all of these things tend to tie together. So in 2006, I ended up becoming positive for HIV, and I was in the midst of my addiction, and it just sent me spiraling, just horrible, into meth addiction, even worse, alcoholism. And eventually, I was able to kind of get plugged in with community help out there in the Twin Cities and slowly started getting my health back in order and life started improving. I still struggled with my substance use disorders and all of that, but ended up becoming stabilized with my HIV, and I moved back to Bismarck and found recovery.
Sure.
At that point, I was not talking about my HIV status at all.
Right.
That was something that was very private to me. The community and the stigma around North Dakota is pretty prevalent.
Sure.
Not very open to having conversations about this.
Right.
And so I kind of pulled back from my HIV activism that I had been involved with in Minneapolis and kind of pulled back into the closet with all of that. After a few years, I think it was 2017, roughly, that I ended up getting plugged into an HIV advisory group for the state health department.
And that was under Burgum?
That was, yes.
That would be his administration, right?
Yep.
Okay.
Yep. So it was with the North Dakota State Health Department, and I was able to actually meet quite a few people who had been doing this work for years. Marilyn Yellowbird, she's a public health nursing director out of MHA.
Yep.
Jolene Keplin out of Turtle Mountain, as well as a few others who were really active and had been doing this work in the state for years, advocating for those living with HIV. And I got involved, and I started getting more and more involved. Started sharing my story with nursing students down at University of Mary, and really started this push for the state had never had an HIV nonprofit. Everything had been ran by the government. And so it wasn't always accessible, and they didn't always hear exactly what people on the ground were needing. So I kept trying to get everyone else to do this, tendency to push this off. Can I find someone to get into this work? Because I'm really busy with life and I just don't have this. And finally, what happened is they disbanded the group that had been around since the 90s. I fought against the state health department, was able to redevelop.
When you say disbanded, was it just kind of a rug pull?
It was during COVID.
Really?
And
Okay.
Yeah. COVID hit in 2020 and they disbanded the group that had been around since the late 90s.
Wow.
And was pretty much the only voice for people living with HIV in the state because there was no nonprofit. So it caused a lot of friction, but the health department was willing to listen after I kind of said, federal lawsuit, different things like this.
Sure.
And
Yeah, good for you.
sat down with them. All of this comes from recovery, which is crazy.
Yeah.
It helped me advocate for myself in all areas in the greater community. So working with the health department, got to develop a new advisory board for the state, was able to get funding for a peer-to-peer group for people newly diagnosed. So those living with HIV, helping those who are newly diagnosed, and expanding services such as syringe services, prevention, testing, everything that you can think of.
Cool.
This all spitballed until eventually I got the idea in 2023 that maybe, further down the road, we could start an HIV nonprofit and
Sure.
try and start helping folks. Around that time, a few months after it all came to me that I was probably going to have to take the lead on this and build a network of people trying to work on this, I ended up suffering a loss in my life. My partner, who also had struggled with substances, ended up passing down in Phoenix, Arizona. He had been in recovery for a little while and walked away from his sober house down there.
Sure.
And ended up ODing while he was down there.
Yep.
And he had kind of been my biggest push for the recovery that I was living and to try and help those living with HIV. And so at that point is when everything changed. And I was like, all right, we're just going to do this. I think I may have been running from grief almost and ran into trying to help others. And that's when I ended up launching Shine Bright and Live, which
Shine
is
Bright and Live.
Shine Bright and Live.
Yep.
North Dakota's first HIV nonprofit.
Outstanding.
Yeah.
Outstanding.
So
When was the ground kind of broken on that?
January of this year, 2024.
Okay.
So
Can you kind of get into a little bit about what your initiatives are with it? Can you get into a little bit about how you
Yes.
what's there, what is it?
first off, this year's 2025. I need to jump on that.
It is.
January of 25 is when we rolled this out. 2024, we really started doing the work on it.
Sure.
So at this point, life is crazy. I ended up securing some funding from the federal government and state health department.
Cool. Yep.
And the main goal for me, there's already caseworkers across the state at public health who work with people who are HIV positive, get them involved in the federal program called the Ryan White program, which helps them out. My big thing is that half of the people living in the state who are HIV positive are not in case management. They're out there on their own, and nobody is seeking them to find out why they aren't in services and to try and bring them back into service. And the majority of what I've found so far is that it's substance use disorders, people with alcoholism and addictions who are falling out of service, people with homelessness who are falling out of service, and people living in poverty who just don't have the access in rural North Dakota to the help that they need. So that's my main focus, is how do we get them back into service? Because the main part about stopping transmission for HIV is to get somebody on medication.
Sure.
In today's day and age, if you are on HIV medication, you can no longer transmit the disease to anybody else.
Really?
Really.
Okay.
And that's the big thing. It's twofold what Shine Bright wants to do. It wants to get people into service, to get them on medication, and it wants to educate the public because North Dakota is way behind on education.
That was going to be kind of a question of mine is, do you think that the stigma, I think that's a fair word, the stigma of HIV is still pretty prevalent in North Dakota?
It is. Yeah. We don't know what we don't know.
Sure, of course.
You can't blame anybody for it. But what I can do is I can be a voice to start sharing. Talking about my own status is petrifying for me, to get that out there, because the judgments are there and you don't know people you've been friends with for years may suddenly have a different view on you. But how can I be an advocate or an activist for HIV in the state when I'm not even willing to put myself out there?
Sure.
So the big thing for me is that it's lack of education.
Yeah.
And that's primarily it. Right now I'm focusing on building what's called a speakers bureau of people living with HIV or those working in the field who will go out to medical students in the state and start teaching our next generation of nurses and doctors how to treat people with HIV and how to defeat the stigma that's out there, even within our medical community.
Yeah.
Yeah.
That's awesome. With, when to kind of backtrack and just make sure that we're covering bases and just giving everyone an opportunity, as you were going through starting your 501c3 status and going through, did you create a board as well?
I have. Yeah.
Outstanding. Okay.
Yep.
And then is it, how many do you have staff?
It's myself and an admin. Yep.
Outstanding.
Yeah.
Okay. You said you had secured federal funding and health department funding.
Yeah.
Yeah. How is the state? I mean, have they been approached about this? Have you outreached to them and let them know I'm here now? And have they been receptive to this idea?
They have. They've
Cool.
been very supportive.
Yeah.
Right now, federally, with funding for all across the board, things are kind of up in the air.
Sure. Well, yes. I mean, you're 3 months in.
Yeah.
That's okay. Yeah.
Yep.
Hell yeah.
3 months in, we are looking at possibly funding being cut out from under us, but that doesn't mean the work doesn't keep going.
Sure.
So the way as things transitioned over this last kind of election period, and administrations change all the time. I'm not here to take a political stance on anything. I'm from North Dakota. We vote all over the place.
Yeah, that's true. Right.
For me, it's that right now there's big cuts to federal funding, and it possibly may hit my nonprofit. So what do? How can I pivot so that I can continue with the work without worrying about funding? And education is a big part of that. I don't need to be paid to go tell a story.
Sure.
I don't need to be paid to share information. So if it takes a slower roll to get things going, because eventually what I'd like is an HIV clinic for a one-stop shop with housing for those who are falling out of service, a low to no cost housing unit. So based in Bismarck and in Fargo, the two main areas.
That'd be incredible.
Yep.
Yeah. And then do you, I guess on a personal level, do you find that being I met you in North Dakota, we're talking in North Dakota, so you've stayed here.
Yeah.
And I know, again, we try not to get too deep into the politics on here, but it's at times it's unavoidable. Do you find that your calling of what you're doing is exacerbated or compounded because you're in a state that has those limited resources, and it's sort of like, if I leave, if I'm not here, I'm not saying somebody else isn't going to do it, but who's going to do it? Does that make sense?
100%.
Yeah.
Wow. After my partner Johnny passed, it was really difficult for me to stay here. And I would say my biggest internal struggle is, do I stay or do I go?
For sure.
And I sit and I balance everything in both of those categories, and I never can come up with an answer.
I know what you mean. Yeah.
It is, do I believe my life would be easier, quote unquote, so to say, if I lived elsewhere, maybe in a bigger metropolitan area? Possibly. Yeah.
Yeah.
But can I live with the fact that I'm from North Dakota, and right now I'm one of the few doing the work here? And if I leave, is someone going to pick it up? I don't know. Do I sometimes, when I get annoyed that I had to find recovery in North Dakota of all places, and I've planted roots here, it's a struggle between my community that I love, because I truly love Bismarck, Mandan, and surrounding areas. I truly love North Dakota. Do I like it all the time? No.
Right.
But I have this passion because I'm from here, So do I leave and sacrifice the work and the investment that I've made here to be happier, possibly personally? I don't know.
Sure.
It's such a struggle.
Yep. I get it. I see, we're friends on social media, and I see your travels. You go to New York City and this and that. I swear to God, this is true, is when I see you on there and you talk about how much you love these cities, I think he's gone. 100%, 100%, because it's such an authentic, I love this place. Yeah. And I totally get what you meant. So, I mean, we're MHA members here. We stick up for our people. We do everything we can to, within the scope of our work here. Right. And maybe being in this work is a calling, maybe sticking out as a calling. And at the same time, I completely understand what you mean about being in the state of North Dakota. I was just down in Florida a few weeks ago, and I was speaking at this thing, and I said, "Yeah, it's winter in North Dakota, and it's here." And like, you just see all the mouths drop, North Dakota. Ooh, you know what I mean? And there's always that thing of the hell am I doing returning back there? It'd be easy in a way. It would be justifiable to say, my life will be better here.
Yeah.
But I completely understand the allure. I can promise you, we are here, my wife, my family, and I, we are here unless something drastic happens, because I love it here in the same time. In many ways, it's a state that's, I love the quietness. I love the resources it offers. I love the people as well. A handshake still means something. There's something that's very alluring that keeps me here, you know, aside from the work that I get to do, aside from the fact that our people are here and we get to help them every day. You take that out of the equation, it's still a hard place to leave, you know? So I get it. There's no judgment on that end, you know? And so with the nonprofit being brand new, you have a board created, you and an admin are going out, you guys are doing the work. Do you guys have, you talked about wanting to create a center of kind of a one-stop shop for HIV services in the state of North Dakota. You talk about doing education, outreach, networking, of all that stuff. And you talk about doing the funding. And I get that. We have meetings almost every day. Yeah. There are conversations almost every day about federal funding being pulled. There's a lot of question marks, a lot of what ifs, maybes, what have yous. And so that leads to other meetings about how to mitigate that in case that happens. What are we going to do? You know, and do you seek outside funding? And this is also just for individuals as well that are listening. Do you seek and accept outside donations as well from, you know, maybe private endowment funds? You know, whatever that looks like for you.
Definitely. Yeah. We do contributions. When we first rolled out, the funding was suddenly up in the air. We had no idea if we were going to get any. Yeah. And so I said, you know what, let's just reach out to the community and see. And the community responded. We ended up with like $3,000 within a week, which was great to kind of get us off the ground and to help with establishing it. It's interesting. I had planned on leaving my full-time job and starting the nonprofit and becoming the executive director as well as the founder. And when all of the funding went up in the air, right now I am working 4 10-hour days up at my main job at the state of North Dakota. Okay. And then 3 days a week I work in the nonprofit full-time. And then in the evenings, I'm finishing up my degree right now in business management.
Outstanding.
So life is a little hectic.
What school do you go to for the business?
I'm just finishing up BSc right now, my first 2 years. And then we'll be debating on if we have capacity for 4.
Yeah, sure. No, I understand that.
Yeah.
And then what was my I had the follow-up here. Could you, because our podcast is, you know, we blast this out to our tribal communities and we receive a lot of feedback from our tribal communities and different tribes and different health departments and that. Do you have, how does your program impact tribal members? How can it impact and improve the lives of tribal members as well? And also, like, can you speak a little bit about on the stigma that you see, if you see any with tribal communities, and you know, call out what you see as being needed up there? You know, how can you come up and give what you have up there?
Definitely.
Cool.
I appreciate you asking that. Yeah. You know, living in North Dakota, I think at times there's this separation between communities. And what I have found that is beautiful within the HIV work since I've been here is that there is this understanding that everybody who lives in the state is affected by HIV. It doesn't matter where, how, who you are. We all have a part to play in this. One of the biggest things is state of North Dakota has a very small HIV population. I was looking as of 2022, last time we had data, there were only 578 people living in the state with HIV.
And that's considered small?
That is. Comparatively, I think Montana has the lowest population, you know, per capita for the country, but there's a huge disparity.
Sure.
Within the state. American Indians and the indigenous peoples were 10.6 people out of per 100,000. Mm-hmm. And that's double what the white population has for people living with HIV. So knowing that indigenous populations are smaller than the white population within the state, yet they have a higher rate, that's some disparities that we really need to address.
Sure.
And I can see that's why when I got here and got active in, 2017, 2018, there was a representative from every one of the tribal nations on these boards and advisory boards, because they understand that there is a stigma within Indigenous populations where it's not talked about. Historically, HIV isn't talked about or spoken about, and there's rising rates of IV use, which is a huge transmitter of HIV, and Indigenous peoples have the lowest rate of medical adherence, so taking their medication so they become untransmittable.
Sure.
Now, why? Well, we all know why. It's lack of access to services,
Right.
lack of transportation, lack of services available. IHS is overwhelmed a lot of the times, and there's stigma within communities. If they see you going to certain areas for help with HIV medication, people may just avoid it altogether.
Sure.
So it's a conversation. My biggest goal within the first 2 years is to get reconnected with all of the tribal liaisons that are within the state to be able to work with IHS.
Cool.
That's something the health department has tried, and it's somewhat successful for the state, but I know that an on the ground work is more important.
Yeah. Yeah.
Yeah.
And so even through a percentage, you said there's roughly 500. I'm trying to think of the percentages as well of trying to even give that to MHA members. I think roughly we have 18,000 members enrolled in MHA. So that would be, I can't think of the math off the top of my head, but do you think that the tribal communities why do you think, why do you think that tribal communities are impacted more? Why do you think, do you think that it's going to be tougher, or how do you want to navigate reaching out to these tribal communities? Do you ever think of like outcomes and goals and what this is going to look like? At the end of quarter one, I want to get up and going. I want to get my admin hired. I want to get my doors open, my lights on. At the end of quarter two, I'd like to have the,
Yep.
And then at what point are the tribal communities, thrown into your initiatives here?
Quarter 4 and quarter 5.
Cool. Yeah, fair enough.
Already got it in the business plan.
See, right here.
I'm just heading into quarter 2.
Yep.
And I'm hoping by the end of this year to be able to have some more open conversations.
Yeah.
And utilizing the connections I've already made throughout the last few years. Tila Baker and I were able to share a stage at a state health department event, and ended up finding out Marilyn is Tila's mom, and that blew my mind.
Yeah, she's a powerhouse.
Right.
Tila's a powerhouse, yeah.
And Tila kind of motivated me to help tell my story even more fully.
Cool.
So these connections that we make, I don't have to hide a part of me anymore.
Yep.
I can be a whole health person, because how can I help a community if I'm not fully whole myself?
I love that.
Yeah.
Yeah, I agree. And, sometimes it's that twofold thing. I mean, I understand what you're saying of I need to be transparent about who I am and what I am. And I have to be transparent about I'm okay with this, and I have to be transparent about I used to not be. And these are the things I did to get here, but I also think it's an evolving thing. It's a very fluid thing. I fully get that on a grand lesser scale. Like I'm trying to shift over to my own health, my own physical health. I went up to our Sage Coulee today, and I stood on the little scale, and I put my little thumbs on the thing, and it measured out my body fat and my freaking water fat. And I'm so like, ugh, so I'm going to get home and I'm going to like just go run on the treadmill, for a while, and but I also think it doesn't have to be as frantic, right? It needs to be methodical. It needs to be thought out. It needs to be, beneficial and equitable for the entire state, because I don't know that I have the right to say this is going to be an easier path. Maybe it's easier to spread awareness in Fargo than it is in Williston. But why are my resources directed towards them?
I'm really glad you brought up that.
For
exactly
sure,
that point. I could have posted up and started this nonprofit in Fargo and had easier access to everything.
Yep.
I would have had a more open community that would have been more supportive, possibly a larger support base for doing it. My main reason for sticking in Bismarck is because Central and Western North Dakota are historically neglected in all service access. When we talk about, transmission and rates of HIV right now, the MHA nation sits on what county again? I think it's
Montreal County.
Montreal.
Yeah.
And there is a 6-county area, including Montreal, that is rising in the HIV infections, as well as a lot of other things, IV services and issues with all of that. And so being able to stay focused here, and my main goal these first 2 to 5 years is central and western North Dakota before we start branching eastward, is because we deserve just as much access to services out here that everybody else does.
Yeah.
And so why don't we put more resources in this side of the state?
Yeah.
So could I go to Fargo and possibly travel easier, have a bigger community? Yep. But I don't have time for that.
Sure.
I have time to help others. And the most help that's been needed historically is over here.
Yeah.
So
love it. Do you work at the public health at the county levels as well?
Personally, do I get paid to do it?
No, not necessarily
no.
paid, but do you outreach to the counties,
Yes.
of just kind of compiling data in seeking, I don't know if you're doing like FOIA requests or something like that in order to just get the numbers in front of you.
Yes. And right now I'm actually the chair of the North Dakota HIV Advisory Board.
Okay.
And so in doing that, we're coming up with our next plan for how the state's going to address HIV for the next 6 years.
Okay.
So the data I've kind of been giving you is the previous 2022 was the last time we pulled a bunch of data. So right now I'm working with Grueneich, the director of Burley Bismarck Public Health. I've reached out to Mandan and I'm trying to start locally to see how to navigate some of these areas and communities and organizations before I start branching out further into like Williston, Minot, Dickinson, and then spread from there to the rural areas. I'm trying to build on it because at this point it's just myself with some admin backup.
Sure.
Which thank God for my admin,
Mm-hmm.
working 2 jobs. If I don't have that support, I wouldn't be able to do half of what I do.
Yep. Do you, and so the HIV Advisory Council is back for North Dakota?
Yes. We helped redevelop it.
Okay.
Yep.
And so with the new administration, with, Kelly Armstrong being the governor now, has that been met with
big support?
Cool.
And actually just recently, one of the main wins that I've had as Shine Bright and Live is we recently advocated for the decriminalization of HIV in the state of North Dakota. And when you're looking at it from far away, you're going, why would we want to do that? It was in our state, it was a felony to transmit HIV without telling someone that you were positive. But the way it was written, because it was written in the mid 90s, was that whether you transmitted or not, if you didn't constantly share that you were HIV positive, you could be charged with a felony, facing 20 years in prison, a $20,000 fine. As we looked into it more, we realized that victims of sexual assault could be charged by their perpetrator, by the rapist. Mm-hmm. We found out that if you were in a bad relationship or had a bad breakup and your partner or wife or husband decided that they wanted to say you never told them you had HIV, they could. And now you had to prove in a court about a private conversation whether it occurred or not. And so there were so many pieces of this. North Dakota, for the first time, is one of the leaders in decriminalizing HIV. And it's been a national movement. For the last 5 to 6 years, it's really been taking off. And for us to have done the work over the last 3 sessions, and in this session, we were able to get it decriminalized. I'm actually going to be going to a signing with the governor here shortly. Blows my mind, man. What it does is it takes away the stigma of criminalization. There's already laws that protect people who would have a malicious intent and be going out there and spreading this virus purposefully. Right. And so we don't need a separate law that actually stops people from getting tested. They're scared. What if I am positive and suddenly I get charged with a crime when I didn't know what was going on? Right. So they just don't get tested. So the biggest thing is we need to put HIV in the hands of public health, not a criminal court. Sure. So there's 100%. So much going on. 100%.
So as you were, did you go to the legislative session and testify in favor of this and all of that, and did your lobbying with the state? Because I know our legislators are anyway.
Yes.
How was that experience?
It was overwhelming.
I bet.
Petrifying.
Told
my story.
Hard not to judge, probably. Yeah.
Ended up made some great relationships too, and learned a lot about the process. I had been someone who'd always advocated about voting, but I didn't think anybody really listened
Sure.
after we voted, you know?
Yeah.
So to be able to walk through the process and have some human conversations one-on-one with some of these legislators and see that we were able to build support, it blew my mind. I'm working with some national kind of HIV organizations, and they cannot believe we pulled off what we just pulled off.
That's cool.
Yeah.
Yeah. Do you think it's because of the state that we're in, or do you think it's also just, I know that with these other states, they're going to be looking at North Dakota and they're going to figure out how did they get this done?
Yep.
You know, I know that when the property tax bill failed in our voting last year, our election last year, there's a number of states that were looking, that North Dakota, I think, was the first one to put this on the ballot. And they were looking at the outcomes of what was going to happen. And they were going to decide if it was worth it to try to, gain some traction in their own state on this or not, or what went wrong or what went right or whatever. And so I know that there's kind of that positioning as well, and have you been able to kind of outreach that? I mean, that could be another initiative with the nonprofit is I'll help you.
Something, the Elizabeth Taylor AIDS Foundation reached out to me. It's a national organization that's been around since the 90s. Elizabeth Taylor was a famous actress for those of us who are younger, and was a huge supporter of AIDS when the AIDS panic kind of took off in the 1980s. Yeah. But they're saying that South Dakota and people from Montana are already wanting my information. And what I want to remind people is that this wasn't just me.
Sure.
This wasn't just Shine Bright and Live. This was a group, a coalition of people who came together. Representative Gretchen Dobrovich out of Fargo had been bringing this bill for 3 sessions. Canopy Medical Health Services out of Fargo worked with Shine Bright and Live, and we got people living with HIV to come and give their testimony. We had the director of the North Dakota Health Department's Sexually Transmitted Infection Division testify in favor of this. We were able to get people who hadn't spoken up before come and speak up because some of us were willing to finally take that step.
That's outstanding.
Yeah,
absolutely. What do you think, if you could pinpoint or identify a couple, barriers that the state of North Dakota still has in terms of, HIV resources, and also other, barriers within the public health as well. I mean, how about Sanford? I mean, have you worked with the hospitals as well? Is there any work to really do with the hospitals right now?
There's a lot.
Sure.
I think the main thing is we're finally getting more and more voices of people living with HIV to speak up and be a part of the process that goes through in how you address services. And I want to pull this back because everything's connected. As a person in recovery, moving back here in 2016 and watching our governor set up a whole system with his wife about how recovery is approached and how you defeat that stigma in recovery,
right? How
you set up peer-to-peer programs, peer navigators, all of that for meeting people who are struggling with recovery by those who are already established in it. All of this can be tied into every area of what we do.
Yeah.
It all comes down to community, listening to the community and what they actually need right where they're at, not what I feel they need. I can come up with all kinds of hypotheses about what I believe. I can go and get a degree and it's going to tell me all kinds of book knowledge about how we should approach this.
Right.
But if the people who are dealing with the issues aren't brought into the conversation, we never fully can address or understand what's occurring at that level.
Yeah. And I think that can be applied into so many different sectors of life. I mean, truly it's the same idea with recovery. It's the idea of identification.
Yep.
If I can explain to you, not talk at you, not tell you what a book taught me, to tell you,
right?
Not tell me what it's, that you need to be feeling this way, or it's this or that, right?
Yep.
If it's just, I'm here and I lived a life that involves the same things that involve you today, I don't know what is or isn't going to click. Yeah. I know what I did and I'd like to share it with you,
The beauty of this is, just like in recovery, I used to be a patient at treatment centers, right? And now I get to go and share my story at treatment centers.
Yeah.
Just unbelievable.
Yeah.
I used to be someone who needed the services provided by the Ryan White HIV program. I needed help with housing. I needed help with medical attention. I needed help with all of that. And now I'm administering grants for that same program to help others.
Yeah.
It blows my mind.
Yeah.
Anything is possible in this world. I don't have to stay stuck in the dark. I can flip my life into ways that I never could have imagined. I'm sitting here and my life just blows me away every day.
Yeah. What would you say to, so I guess another question in regards to insurance is, I just have no idea. Does Medicaid, does Medicare, do they cover these HIV medications as well? And is it affordable for individuals?
So HIV medications are not affordable.
Okay.
This life-saving HIV medication that stops a person from transmitting the virus can run anywhere from $3,000 to $8,000 a month.
Wow. Okay.
Without insurance help. The majority of insurance providers only cover a portion of it.
Sure.
So this Ryan White federal program covers the parts that aren't covered by your insurance. And Ryan White programming is limited by poverty level. So North Dakota has the highest. We go at 500% of the poverty level, something along those lines.
Sure.
So they try and make it as accessible to everyone that they can.
That's outstanding.
But there comes a time and place where you're doing well in life and suddenly you no longer have access to these services. So you're paying a lot out of pocket to make sure that you're staying alive and that you're not transmitting this disease. The moment you stop your medication is when HIV kicks in and starts replicating in your body again and can lead to AIDS, which a vast population hasn't been involved in since the 1980s, 1990s,
right,
in seeing what that looks like.
Right.
So access to these medications is imperative for helping our communities.
I agree. Do you think that, and again, with these potential Medicare cuts and Medicaid cuts, I mean, like even with our organization, our tribal members with a large number are on Medicaid, on Medicare. How can we continue to provide the services? I mean, here's the thing: we're still going to do it no matter what. If we have to eat the cost, we'll eat the cost. Like we're going to do it. But do you find a world? Do you see a world where you're out there, on Capitol Hill, navigating that system in order to lower those costs for those prescription drugs? Or how do you even think that that's possible to do, at this point?
Yes.
Yeah.
At the end of the month, I was supposed to be heading out to DC.
Yeah.
For a national HIV lobbying week.
Yeah.
Because of all the funding cuts that are possible, I ended up having to drop out of that. I have surgery and some stuff coming up that I felt was more important to focus on what I can do here. But do I see myself in the future? Yeah. Do I want to? No.
I get it.
I want nothing to do with politics.
Yeah.
As much as I know we need access to it and we have to be a part of it, it is not at the top of my list of what I look forward to in my life. If I could go a day, I would much rather be out in a field helping someone who has been drinking all day, who needs access to medication, and trying to find them housing than be in a suit and a tie up on Capitol Hill lobbying. I think it's ridiculous, but I know it's a part of the game.
Sometimes the individuals, and this is my opinion, the individuals who seek to benefit the least are the ones who need to thrust themselves in it the most. Jason, I think you will find a way. You stay in Bismarck, you move to New York, you move to LA or Hawaii or something, like you're still going to bring Jason with you. Yeah. And that Jason is a successful individual. He's a charismatic individual. He's a joyful individual. He's all the things. He's energetic. All of that stuff stays, right? All of that stuff stays with you no matter what. You're not financially motivated. There's nothing within it that would say I am going to gain, right? And so that's why I always feel that those individuals, the ones who have the least to gain, are the ones who should thrust themselves in it the most, because there's no personal event, there's no personal initiative, there's no vendetta against something. It's just I see a hole in a system, I see a gap in a system. Maybe I can help it, maybe I can't, but I'm going to throw myself in it the most. I also think that the work you're doing is very crucial, because truthfully, I did not know until just now that HIV could be stopped through stop transmission through medication. I know that advancements have been made. I 100% know that, but I did not know to that extent. I also think that there is still that stigma. I remember hearing about HIV and AIDS in the 90s, kind of when it was coming. And there was the fear. It was like COVID all over, of this not knowing, and, go buy toilet paper and we're all going to die and this and that, And now it's morphed into this thing that it's navigable.
Yeah.
It's navigable. And from it can spur hope, can spur joy, can spur freedom. Like that's kind of the turnaround of humanity.
Right.
And I don't think it happens without people like you. And there's people that need to hear you that, unfortunately, for our better or worse, are making those decisions. Does that make sense?
It does.
And so, we support you 100%. We support you all the way. What would you say to somebody today, right now, who fears they may be HIV positive or is newly HIV positive? What would you say to that person and has that fear, has that unknowing?
You're not alone.
Yeah.
You don't need to deal with this by yourself. There's a whole community that's ready to love you and to bring you in and to show you that this is not a terminal disease anymore. This is manageable. Like you said, you can navigate this life now. Is it life-changing? Yes. But you can live a healthy, full, productive life today. But you need to get connected to that community. You need to be plugged into help for medication. And if you're struggling, because it's shown, it's proven, those living with HIV, that community has a way higher rate of alcoholism and substance abuse because of the stigma, because of the fear. You don't have to live in that darkness alone anymore.
Right.
You can have a healthy, productive, fulfilling life and live with HIV. You don't need to be an outcast. It's not the way it used to be. And sometimes our minds can stop us from getting that help. They really can. The fear can petrify us and keep us stuck and stagnant. So walk through that fear. Reach out to me. Go to shinebrightandlive.org and send me a message. Before I ever got involved in this nonprofit, I used to go to the infectious disease clinics across the state and I'd give them my phone number. And I said, if someone has no one to talk to and they come up positive, give them my number. We do this as a community. We don't do this alone. It takes just one person reaching out to another person.
Yeah. Do you feel that, and just truly, and I don't mean to ask this in a bad way or anything, but do you feel that you're having HIV, do you view it today as like a strength? Because I get it. It's like, it's HIV, you know what I mean? But it feels to me like you've turned that into a strength in your life. Does that make sense?
It does.
That you've turned it into something that you've overcome, that you've recovered from. And Lord knows we have enough people out there that are seeking recovery from one thing or another. How do I turn my alcoholism into a strength? How do I turn my fentanyl usage into a strength?
Yep.
But you can.
You can.
You 100% can. If it defines you, that's okay. Does alcoholism define me? Yeah.
Yeah.
100%. You know what I mean? Yeah.
Right. My story and my journey can help others so that they don't have to walk through the darkness that I did. When I was positive, if I would have understood when I became positive that I could get help and find resources right away, I may not have gone down that 6 more years of hell that I walked through, being homeless on the streets of Minneapolis, being strung out, being drunk.
Right.
I could have been in a different place, but that story and that journey make me who I am today and can help others, so maybe they don't have to walk down that road.
Yeah.
So definitely my HIV status is a strength in my life.
Yeah. I agree. I emphatically agree. I'm really excited to see where it goes. We have individuals that come into our services that we refer out for services that we just know all the time. And having what you're doing available, especially being the first of the kind in the state, is huge. Yeah. I mean, that is huge. And it's huge for the state of North Dakota. It's huge for progress that can be made. It's huge for planting a flag and saying that change is effectively change is coming. And this is what it looks like. You know, it looks like being okay talking about things that we used to sweep under the rug.
Yep.
That we're not going to turn our back on uncomfortable conversations anymore. That helping our neighbor and shaking hands of individuals means something more than just identifying ourselves, right? That I care about you as an individual. I want to get to know who you are as an individual. That I want to hear the story of you, and I want to hear what makes you tick, what makes you hurt, what makes you humble, you know, and ultimately, like, what can we do to help each other, you know? And so I think what you're doing is fantastic. Do you want to share a little bit about like your hours of operation and how to reach you and all of that stuff?
Yeah, definitely.
Yeah.
Right now, operation hours are kind of limited. I'm working out of a church at the moment.
Yeah.
And so we're open full time on Thursdays and Saturdays over at McCabe Lutheran Church or McCabe Methodist Church. Wow. I'm a member and I just forgot that.
Lutheran, Methodist.
But, you know, I haven't been active in the church in years, so this blows my mind still too. The main way to get a hold of us is online. shinebrightandlive.org is a perfect way to reach out. My contact info is on there. My phone number is on there. My email is on there. director@shinebrightlive.org.
Cool.
So that's the best way to reach out.
Outstanding.
You can find us on Instagram, Facebook, Threads. I don't even know all of the different stuff.
The whole thing.
Yeah.
You know, and I'm really interested in watching it, where everything that you're able to accomplish. Love to have you back on here down the road and just catch up with you again and hear about everything that Shine Bright and Live has done and you and yourself have done as an individual. You have a very, very impactful story, a very raw, very real story of what life is and also what life can be, you know? And so, you know, keep being yourself, keep having the energy, keep shining bright and live. But man, I'm super happy you took time out of your day. I'm ecstatic for you that you get to go and sit with the governor and sign a bill decriminalizing HIV. I think that's huge. I also I just didn't know. I didn't know that it was a felony of that magnitude. And again, that's just the ignorance of myself. I don't want to blame anybody else. Like, that's just my own personal ignorance of not knowing, you know? Yeah. And look, if you can do that, if you can lobby to help get that decriminalized, if you can start a nonprofit, if you can make time for everything else that you do, I don't have concern that the things that you want to accomplish will be accomplished. You know, I believe. So, man, I love you, and I'm very happy you came, and look forward to having you again.
Thanks, Gray. Love you too, man.
Cool.
I appreciate being here.
Yeah. Thank you all.
In this life we live free, yeah. In this life we live free, yeah. In this life